Welcome to the Adventure Joe podcast. I'm very excited to welcome Dr. Kyle Stephenson to the podcast and for our health segment. Dr. Stephenson, welcome.
Thank you very much, Joe, for having me. I appreciate you.
Absolutely. I appreciate you coming on. So let's get into Dr. Stephenson's background and talk about his new joint health center he is launching here soon. But first, to viewers, let's introduce Dr. Stephenson, his background and bio, and get us some good stuff. Dr. Stephenson is a fellowship-trained sports medicine orthopedic surgeon. He received his bachelor's degree in exercise physiology from the University of Indianapolis, where he also played baseball and football. He received his doctor of osteopathic medicine at Lake Erie College of Osteopathic Medicine, Bradenton, Florida. Dr. Stephenson also completed an orthopedic surgery residency at Michigan State University and a sports medicine fellowship at the New England Baptist Hospital in Boston, with additional training at Boston Children's Hospital. Dr. Stephenson worked as a team doctor for the Boston Celtics and at Merrimack College, in addition to serving as a clinical faculty member at Tufts University Medical School. Dr. Stephenson specializes in sports injuries, arthroscopic surgery of shoulder and knee joints, cartilage restoration, and fracture care. He also performs shoulder and knee replacement surgery. His clinical philosophy is to develop personalized care plans that are in the best interest of his patients and their lifestyle. Also, as a native Hoosier, Dr. Stephenson is excited to be back home in central Indiana. When not seeing patients, he enjoys spending time with his wife and kids, working out, playing golf, outdoor activities, and traveling. Awesome stuff.
It's good. Yep. I appreciate that.
Absolutely. So kind of how we connected and kind of share with viewers is Dr. Stephenson and I also went to the same grade school in Indianapolis in high school, and I've actually known his family and parents for many years. And how we kind of connected with the Adventure Joe podcast is Dr. Stephenson is also aware, for many years, I've been an outdoor athlete and mountain climber. And for a few years, I was climbing what's called the 7 Summits, the highest mountain on each continent. I was on 6 of them, including a month in Antarctica. Most recently, in 2005, at the age of 55 years old, I went with 6 others to Nepal, and we trekked to Mount Everest Base Camp. So, of course, for myself, wanting to stay active and healthy, and at the age now of 56, I turned 56 in January, I'm currently planning to return to Nepal this September and do a second trek to Mount Everest Base Camp. And hopefully there's also plans to go in November to Mount Kilimanjaro, which I climbed successfully in 2005. So obviously, for me, I'm honestly very interested in joint health and staying healthy and active as long as I can be to, enjoy the outdoor activities and kind of, the strenuous activities I enjoy of mountain climbing and long strenuous treks. So with that, Dr. Stephenson, please share with viewers more about your new Joint Health Center of Indiana. And what can patients expect from these non-invasive treatment options?
Yeah, no, I appreciate that. Impressive what you've done. First of all, it's amazing the things that you're doing that, very small percentage of people in this world have done. So very impressive to you. But yeah, what we're doing with Joint Health Center of Indiana. So my brother and I started it. We actually opened up last month on the south side of Indianapolis, but this has been years in the making. I've been in orthopedics as an attending for 8 years with training of, residency, fellowship, medical school, all that stuff for, 6 to 8 years before that. So total of about 14 years in medicine. My little brother, Brad, is an orthopedic PA. So he's a physician's assistant. He's been in orthopedic surgery for about 14 years. So him and I have crossed paths in medicine. We talk about, patients all the time. We talk about everything going on in our orthopedic practices, but we've always wanted to work together. It just hasn't happened yet. So these last few years, him and I are very much aligned with our mentality of what we've seen in orthopedics and just what we call the gap in treatment. So there's basically, when you come to my office, we treat patients with, physical therapy, cortisone injections, anti-inflammatory pills, things like that. And then if none of that works, then we go to surgery, right? I'm an orthopedic surgeon, and you just read my bio and named a bunch of orthopedic procedures that I do, which I do. But I've learned over the years that I'm one of the most conservative orthopedic surgeons there is out there because I understand that patients can get better with non-surgical procedures or non-surgical, modalities. So Brad and I have had the same mindset, and we learned this thing called orthobiologics, which is using your own body, your own blood, taking the growth factors from that blood called PRP, or known as platelet-rich plasma, and injecting that into the joint. And it actually has way better effects than cortisone, and it continues to work for much longer than cortisone. So we've seen the traditional path. We've been in the traditional path for all these years, and we saw, that it's just not working anymore. And we're seeing more studies coming out saying, why can't you use your own blood, spin that inject that into the joint, and that's actually going to help way longer and much more effective. And so that's how we came together. We started this thing. It's been years in the making, and we literally just opened last month, and we've been very excited about it. We've had a lot of good, outreach and things like that. So it's been good.
Yeah, awesome. Well, also very cool that you and your brother, who are both obviously medical professionals, be able to work together. And I know, knowing you and your family, you're one of the best, honest, most compassionate doctors out there. So
Yeah, we appreciate
cool
it.
stuff. That's great stuff. And I know that anytime you can avoid surgery, right, I think is the best. So, what you're doing with the center and the non-invasive stuff is I think also the way of the future.
Agree, 100%. And you could talk to some orthopedic. Now, I would say most orthopedic groups now are doing some form of orthobiologics, whether it's PRP, another thing called BMAC, which is stem cells, essentially stem cells from the iliac crest. But a lot of docs still love the cortisone. And then when that fails, they go to surgery. And that's the insurance route. That's what they want us to do. That's what hospitals want us to do, because hospitals make the most money when we operate, right? So a couple things on that. We've learned that the older studies, that when they talk about PRP, they had low platelet counts. Okay, I don't want to get too deep in the weeds here, but so some docs would be like, "Oh, PRP doesn't work."
Especially with me. Maybe other viewers are smarter than me, but
I won't get too deep in the weeds.
Try to keep this as layperson as possible.
I will.
At least.
So the old studies would compare, PRP to normal saline, which is just basically salt water, and say, "Oh, it doesn't work." And then newer studies have actually increased the dose of platelets that you use, which are the growth factors. And we've realized that the higher you use, the higher platelet dose you have, so a higher dose helps the patient more. So those old studies really don't work. And now, to your point, this is the future of medicine. Now, if you do a PRP study and you don't have this certain threshold of platelets, then it's not going to count. We're not going to use it, because we know that it doesn't work below that threshold. So that's why when you say the future of medicine, these next 3 to 5 years, we're going to see a lot more studies coming out that are very high level that will show that this is the future of medicine. There's no question. And it's using your own body to heal itself, right? God made us a certain way, and insurance companies will never like it because they can't really get their hands on it because it's your own blood. So where are they going to, intervene, right?
Yeah, and kind of like we touched about earlier about, why, of course, I'm so interested in it and trying to stay as healthy with my joints as possible. But obviously, take that equation out, but, a lot of people in everyday life that aren't doing some of these activities, that want to have more freedom from the pain of joint pain, that just want to be able to go walk with their kids or go for a hike or just enjoy, life in general without, a lot of pain, and maybe have been through other surgeries that maybe didn't work or hold or, right. And that's more back into your field. But anyway.
Yeah. I mean, when you talk about the gap, and that's what I'm talking about is that gap, we're kind of in between. But there are plenty of patients that have had a total knee on one side, know that they need another total knee, but they didn't recover well. They're still in pain, which is really 20% of anybody that's had a total knee replacement. And they're like, "I'll do anything not to have surgery on this knee." And that's where injections will fail, cortisone and gel injection. And so that's where we come in with the orthobiologics, and we can help that patient. Studies are showing that this is lasting for 12 months and beyond. It continues to help heal the tissue, basically. I'm not saying it's going to put cartilage back on your knee, but it is going to heal the tissue in the joints. And so yeah, there are plenty of patients, whether you're young and active and you want to stay active and you have some joint pain, or you're older and you want to hang out with your grandkids, you want to push off a knee replacement. There's actually the best studies in knee arthritis with orthobiologics. It's pretty phenomenal thing. And again, it's the coolest part is it's just using your own biology. And then, really to add to it, when you're talking about health, there's all these things out there, right? GLP-1s, and so Ozempic, Wegovy, all these pills and medications and this, that, and the other. Science always goes back to eating like our ancestors, working out like our ancestors, just being healthy with diet and exercise is really what it all comes down to. And I'm not saying some people don't maybe need a little bit of help with a GLP-1, but overall, just consistency with your diet and exercise is really going to give you the best health overall.
I totally agree, 100%. Absolutely. So it's going to be located on the south side?
South side of Indy. Yep.
Okay.
Down off 65 and Southport Road.
Okay. So how will patients get a hold of you? Is it's open, ready to go, so forth? You want to share?
Open, ready to go. Yeah, absolutely. So our website is jointhealthindiana.com.
Okay.
Jointhealthindiana.com. And you should be able to go on to jointhealthindiana.com, see our website. There's a phone number. You can reach out on there. And there's actually access to our schedule. So you can actually schedule on that as well. If you have imaging, say you went to your own primary care or even your orthopedic surgeon and they did
Okay.
an x-ray or an MRI, we have a link on our website that you can upload those images before we see you. Otherwise, we can always order, imaging beforehand. But yeah, I mean, we're keeping this very, like, we're going to see patients for an hour. In my current practice, we're seeing patients every 15 minutes, and that's only going to get, faster and faster, right? Like doctors are
Every
getting
15
reimbursed
minutes.
less. So it's just
Wow.
quick appointments. So Brad and I we decided we want this to be more of we like to get to know our patients. We love to, have those conversations, really find the pain points of what's going to help them. So we want to spend an hour with them. We want to spend time to really understand how we can help them. And that's the best part of being a doctor, right? Is like to truly help the patient and understand why you're helping them, as opposed to just boom, 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 cranking patients in and out.
Well, I'm assuming that's why I think a lot of people, became doctors in the first place.
Yeah.
I
Yeah.
mean, really,
And unfortunately, not
there's
to
a
get,
desire to help.
yeah, we get into to help patients. And, unfortunately with insurance companies and the reimbursement rates, it is going down for people in medicine in general. We still do well. I'm not complaining by any means, but, now you got to see more patients. So in 5 years from now, I got to see more patients just to maintain, my lifestyle. And so then what's going to happen? I'm going to see you for 10 minutes now. Then
Yeah.
5 years after that, it's gonna be 5 minutes. And it's like, holy cow, we're not even, we're not even providing this bedside manner and service that you're so used to doing. Now
Yeah.
it's like an assembly line. We don't like that. So
Sure.
we're changing all that. And we want to see people, we want to see, 6 to 8 patients a day so that we can spend time with our patients. And we want to make sure they're truly getting the results. The last thing we're doing is keeping track of the patient reported outcomes so that we know if you're 65 years old and you have this problem and we inject this PRP into you, then this is the results what we're getting. 92% of these people are doing well in this age group, and we'll keep track of all that. So the more patients we see, the more data we'll have, and we're going to continue to keep track of that.
Yeah. Awesome stuff. Awesome stuff. So again, Dr. Steve, thanks again so much for coming on. Fascinating stuff. Again, for those viewers listening for any kind of joint pain, definitely check out Dr. Kyle Stephenson, the Joint Health Center of Indiana, and get with him for a consultation.
Mm-hmm.
Again, as I prepare to keep up with some of my adventures and hopefully climb a few more mountains before I can't do anymore, I'll be coming to see you guys for sure to keep my joints healthy and strong.
Absolutely.
So yeah, anything else?
And we want to do what we can to help you out. We're just getting started,
Yeah.
obviously, but we love what you're doing. And no, we're excited. I mean, we both grew up on the south side of Indy. We went to Roncalli High School. So we're excited that our group, our clinic is right in the middle of that community.
Exactly. Dr. Stephenson, again, thank you so much.
Yes,
I appreciate you coming on and sharing your expertise and knowledge. And we'll hopefully we can follow up with you again soon, hopefully.
Yep. Yeah, definitely. Yep, we can do that.
Sounds great.
All right.
Sounds good.
Thank you, sir.
Doctor, thank you so much. Have a great day.
All right, you too.